gentleman stand? Mr. Geoffrey Clifton-Brown.
Thank you, Madam Deputy Speaker. I'm delighted to catch your eye in this very important debate. I commend the Honourable Lady from Yarrow for having obtained it, and I also commend the Honourable Lady from Blaydon in the sincere way that she put her points just now. And I do have one point of absolute agreement with her. The health service cannot function without enough properly trained staff, and I will make those points in my speech. I listened to the speech of my honourable friend, the former Secretary of State for Health, with great care, and I absolutely agree with him, and I doubt there's a single member of this House that doesn't agree with him, that we all want to see forevermore a universal health service free at the point of delivery. And I commend his arguments, and I agree with them as to why that should be. Of course, the health service was dealt a terrible blow during COVID, and we need to catch up from that. We need to improve. The 2-year waiting lists are falling. We need to improve on 18-month waiting lists. And according to data, September 2022, the overall number of people working full-time in the NHS has increased by 2.7%, or 36,000 people, compared to the previous year, the point my right honourable friend was making. However, there are some 130,000 jobs where there are vacancies, and we need to try and fill those. The latest data published by NHS Digital up to September shows that there are almost 4,000 more doctors and 9,300 more nurses working in the NHS compared to September 21. But compare this to 2015, and we have 1,622 fewer fully qualified GPs today, and we are seeing those consequences play out today in the health service. Working in the health care can be very rewarding. However, for many, working with staff shortages, it can be incredibly tiring and stressful. The care they want to provide to all patients is not always possible, and talented individuals are pushed to leave for new opportunities. So, as well as pay, employment conditions are critically important. And that is particularly true in the social care sector, where in my constituency, double the number of people are in hospital today, clinically fit to be discharged, but can't do so because there aren't enough social care workers. And we do need to critically look at how we can bolster that social care system. The recovery of the NHS is very important to many of my constituents in the Cotswolds, who regularly contact me regarding their concerns about accessing the treatment they require in a timely manner. And as I've already said, waiting lists in January this year have fallen for the first time since the start of the pandemic. Elective care was delivered for 70,000 more patients in November compared to the same month before the pandemic, as the waiting list dropped by almost 30,000 compared to the last month. However, there were around 7.2 million incomplete treatment pathways as of December 22, with 406,000 people waiting for more than a year for a consultant-led referral to treatment. So there's much work to be done to be caught up from the pandemic. And we all know that there are problems in the NHS, but I don't think we've had anything like the pandemic since the Second World War. And actually, I think the health service is to be hugely commended for what it did during the pandemic. The speed with which it was able to administer the vaccines, the tremendous care that saved my constituents and every other member of Parliament here live in hospital, I think was to be wholly applauded. The key to combating these waiting times and revitalising the NHS is, of course, to recruit more staff, especially filling those frontline positions and increasing retention. This will enable us to get a greater flow through our healthcare system and reduce the waiting time for all treatments, including critical cancer pathway. We urgently need to invest to train more doctors and nurses, instead of relying on recruiting talented people from poorer countries. And it's no good members of the opposite crowing about the training that was provided when they were in office. I seem to remember when Tony Blair was Prime Minister, he actually shut some of the nursing training centres. So what I think might be of interest to this House, Madam Deputy Speaker, is what I'm about to say. 2 weeks ago, I went on a Public Accounts Committee visit to Denmark to inform the committee on the hospital construction programme that we're about to embark on in the UK, and ongoing work we are investigating in regard to the Department of Health and Social Care. And I think some of the things that we discovered on that visit last week could well be introduced to the health service, and some of them chime in with what my right honourable friend said. So here goes. Denmark faced many of the same issues as we do now: an ageing population, an ageing workforce within the healthcare system, increased chronic disease, workforce shortages, and new needs for educating staff on the latest technology and ways of working. However, they have completely reformed their approach to healthcare in the past 15 years and created a model from which I believe we can learn a great deal. They've closed dozens of old hospitals and are in the process of building 16 brand new hospitals. Most are completed and all the remainder are scheduled to be finished within the next 5 years. But critically, Madam Deputy Speaker, they reduced the number of beds by 20%, instead opting for a policy of far greater outpatient and treatment at home. Even quite complicated procedures, such as chemotherapy, are delivered in the home. And GPs are absolutely the key to this system and are described as the gatekeepers for the rest of their entire health care system. It was made clear that this policy decision, made in 2007, was not an easy one. They've faced significant cultural resistance from some residents that are now required to drive for up to an hour for care. But the overall vision was for patients to spend as little time in hospital as possible. And today, in Denmark, they spend 3.5 days average, compared to 6 in the UK. The aim is to discharge them either to their home or to the municipality nursing or residential homes as quickly as possible. And they make great use of telemedicine wherever possible. This increase in care was possible as the number of GPs within the health care system was increased by 50%. Another important change, and this chimes with what my right honourable friend was saying, in Denmark was the health digital revolution. 97% of the population now have good broadband connections, and all citizens have a unique reference which covers a number of government services, including tax and health. The whole healthcare system has been transformed into a digital and paperless system. Access to medical records is strictly controlled, but is available to the relevant physician treating the patient with their consent. And those physicians update those records in real time. And as my right honourable friend said, appointments are made online through an app, eliminating a vast number of letters and phone calls. Relevant to our new 40 hospital building system is the Danes have now produced a standardised hospital design. And this was not easy, as different specialities have different requirements. So, for example, they have, in most of their hospitals, introduced 4 different sized but standardised theatres. There are no hospital wards. Instead, all rooms are single, with their own bathroom and a bed for a relative to stay overnight or longer. This standardised design will enable hospitals to be built cheaper, quicker, and eliminate the elementary problems that sometimes arise even when our hospitals are newly built. As I said, in the UK there is a pledge to build 40 new hospitals at an estimated cost of £1 billion each. And whilst we have many similarities with the Danes, we are fortunate that we both enjoy a universal, equal and free healthcare system. The success of the Danish system comes from their ability to treat many patients out of hospitals. While in the UK, hospitals are often viewed as an inevitably for many requiring treatment. In Denmark, they are the last resort. There are, I believe, some real lessons we could learn from the Danes. And we need to do that, Madam Deputy Speaker, because it is clear we cannot continue as we are. Our health system is limping on, while increasing the costs of the taxpayer more and more. The recent figures of £277 billion was spent on the healthcare in 2021, which is 11.9% of our total GDP. And some complain that this is out of kilter with other countries in the world. And certainly in the United States, it's 17.8% of GDP, but that is accompanied through both insurance and public finance. But it is very comparable to 12.8% in Germany and 10.8% in Denmark. And both our two countries don't have enough doctors, nurses, and particularly social care workers. For a health service to run efficiently, it must have sufficient and well-motivated and trained staff. Thank you, Madam Deputy Speaker.
Yasmin Qureshi.
Thank you, Madam Deputy.